Okay. It's with a lot of pleasure and great happiness to welcome everyone who has so far joined us for this very important webinar. You're very, very welcome. Because of the differences in time, I will say greetings to us all. For some people, it's good morning. For some of us, it's good afternoon. Probably for some, it's a good evening. So greetings to us all. You're very, very welcome. It's exciting to see that already more than 60 of us are already on the session. And this session that comes in a very timely manner at a time when the COVID-19 pandemic is ravaging all parts of the world. And one of the most critical issues that relates to the pandemic, tobacco control, are going to be discussed. This webinar of ours is going to focus on COVID-19 and tobacco control in Africa. And specifically, we are going to receive findings from a rapid response project that was carried out in Ethiopia, Ghana, and Uganda. And I'm excited to present our panelists, Professor Linda Bold. Professor Linda Bold, I will just introduce her briefly. I will introduce her a bit later in more detail when she comes to speak. But she's the chair in public health at the Usher Institute, College of Medicine at the University of Edinburgh. Very nice to see you, Professor. You're very, very welcome. And as the lead person, certainly people will be eager to hear from you. And in a minute, I'll be inviting you to come on. Also with us from Addis Ababa. By the way, Addis Ababa is my second home. Is Professor Wakgari Deresa, also from the School of Public Health at Addis Ababa University. Salam, Professor. You're very welcome, and it's nice to see you. Together with us is from Ghana, another home of African independence and liberation. From Ghana, the School of Public Health at the Kwame Nkrumah University of Science and Technology is Professor Ellis Owusu-Dabo. You are very welcome, Professor. Hoping that that part of the African continent is doing very well, and we'll hear from him too. I'm in Kampala, and with my sister in Uganda, Kellen Nyamurungi. Kellen is from the School of Public Health at Makerere University, and she was also part of the research team that the findings of today we are going to receive. I must thank very profusely the team or the teams that have been working to put together this webinar. My colleagues from ATCA, African Tobacco Control Alliance. The whole team has been working tirelessly to make sure that we have this coming out. Thank you very much, ATCA team. Of course, Makerere University, the University of Edinburgh, Spectrum, Tobacco Control Capacity Program, the Global Challenges Research Fund. There's been a lot of people to thank, and we are very, very grateful that we can pull this off together. Professor Linda Bold, you are going to kickstart this off. Professor Bold is many things, but I'm going to attempt to briefly say something about her before she comes to speak, and then she can tell us more. She is a behavioral scientist. She has a PhD in social policy, and the research areas are mainly two: the evaluation of complex interventions to improve health, and how research can inform public health policy. A couple of years ago, in 2014. Since 2014, she has combined her academic role with a secondment to the Cancer Research UK. And she is also chair in the behavioral research for cancer prevention there. Professor Linda is a former scientific advisor to the United Kingdom government on tobacco control, and currently she is an advisor to Health Canada and the World Health Organization's Framework Convention on Tobacco Control Secretariat. And she also leads two research consortia, the Tobacco Control Capacity Program, and that involves the research. The teams are in 5 countries in Africa and also 3 countries in South Asia. And also Spectrum. Spectrum involves 10 universities in the United Kingdom, also other partner organizations that are conducting research on the commercial determinants of health. She has a broad spectrum and experience on the matters that we are going to talk about. She also serves as a member of the COVID-19 research funding panel for the United Kingdom's Economic and Social Research Council. You're very welcome, Professor. The list is long. We probably will take the whole afternoon trying to introduce you, but we are really, really excited to have you, and we are looking forward to having your presentation. Very, very welcome, Prof.
Thank you. Thank you very much, Richard, for that very kind introduction, and I'm really delighted to be here. So I'm just going to say a few introductory words about this project before I hand over to my colleagues who've led the work in each of their respective countries. So just by way of background, oh, this is not working. There we go. You are all aware, obviously, that we are in the middle of a global crisis for COVID-19. Here in Europe, we've been very badly hit. There are over 1 billion children globally who've not been in school. Economies are hugely badly affected, and it has had consequences for many aspects of life for almost all countries around the world. As you know, WHO reports from yesterday, there are at least 29 million cases and over 900,000 deaths. And of course, that is likely to be a significant underestimate of the real toll. So addressing the pandemic, as I said, has had many, many consequences. And importantly, I think in most countries, in fact, even those countries with lower numbers of cases and deaths, the healthcare systems have been affected because, of course, they've had to pivot to treating COVID-19 cases or indeed preparing for COVID-19 cases. In addition, the economic crisis has had an impact on not only livelihoods, but also the financing and support of key other public health functions. And we'll come on to talk about that in relation to tobacco control. This is just some data from Our World in Data, which is a fantastic resource and website. I do commend it if you're not familiar with it. They report daily on the cases, deaths, hospitalizations from COVID-19, and you can use their interactive tools to compare countries. And this just shows you the pandemic and its acceleration globally across the world, and then also for the continent of Africa and all the countries involved. And you can see that for Africa, cases have gone up very significantly, particularly from April, from the end of April through all of June. And then as we started to see from the middle of August, for the continent as a whole, some declines, but of course many African countries are still reporting cases. These are the deaths per million people. So this is standardized, this chart, so you can compare. So just the deaths per million people from a comparison globally compared to Africa. And again, you can see there's a little bit of a time lag. It's commonly 2 to 3 weeks between cases being reported, up to 4 weeks in some cases, and deaths. So people have died all around the world, and the African continent has been affected like all other parts. And these are just the cases for the countries in this webinar. So I'll come on to talk about the TCCP project in a moment, but you can see here, if you just compare, the red line is the world from March until the middle of September. The dark blue line is Ghana. The green line is Uganda, the orange line is Ethiopia, and then you can just see how badly affected the UK has been, and we've responded very poorly to the pandemic. We've had over 60,000 deaths in the UK. But you can see that Ethiopia to date, amongst the 3 countries in this project, has been hardest hit. But even in the other 2 countries, we have seen some real consequences. And I know that it's hugely variable across the continent. And I'm sorry that we can't bring you findings from more African countries, because this is based on our existing consortia that I'll talk about. So in relation to smoking in COVID-19, part of our study was linking with our colleagues at University College London, who are conducting what's called a rapid living review of the relationship between smoking and SARS-CoV-2, the virus, and COVID-19, the disease. I do commend this review to you if you're interested. It's freely available on the website, the CHAOS website. You can see the link at the bottom. It's a preprint, I should emphasize, which means this is not peer-reviewed. But this is a very experienced team, and I have confidence in their methods. So what they've done is they've pulled all the data from multiple studies that have looked at whether smoking status is reported commonly from hospitalized patients, to look at the relationship between becoming infected, becoming unwell, being admitted to hospital, and then in some cases mortality. And what you see, as I'm sure all of you have potentially heard in the press, is that combustible tobacco use doesn't appear to be a significant risk factor for developing or coming into contact with SARS-CoV-2, the virus, and testing positive. However, combustible tobacco users, based on this rapid review, are more likely to be hospitalized and are at increased risk of disease severity. Now, in terms of why smokers might be at lower risk of infection, we don't understand that. One of the main explanations might be that simply the studies are not recording smoking status accurately when people are admitted to hospital. There may be other biological mechanisms to do with the ACE2 receptors, particularly, and the interaction with nicotine, but we don't have any evidence on that to date. And the findings of this review are very clear. So it continues to be appropriate for recommended smoking cessation to support smokers to stop as part of public health efforts during COVID-19. At the very least, smoking cessation reduces acute risks from cardiovascular disease and could reduce demands on the healthcare system. General practitioners, i.e. family doctors, and other healthcare providers can play a crucial role. Just to emphasize, this review does not look at smokeless tobacco, of course, of which you have many forms in Africa, and it doesn't look at washer pipe shisha smoking. It's just smoking as in cigarettes, but still a very useful review. And just moving on then to talk about other considerations, just to emphasize, irrespective of this risk for the infection or not, people with underlying health conditions that are tobacco related, CVD, diabetes, cancer, respiratory conditions, of course, they're at far higher risk of COVID-19, and we see that globally in all the cohort studies. So that, I think, underpins it. And just finally, a couple of words about the methods for the study and the platform for the work. So this rapid project was built on an existing collaboration called TCCP, which Richard was already kind enough to highlight, funded by the Global Challenges Research Fund. This involves 5 UK universities and teams in 5 countries in Africa, listed here, and 3 in South Asia. We only had 3 months to complete this COVID project, so we partnered with the teams who had compatible skills and availability, and in this case it was Ghana, Ethiopia, and Uganda. We also looked at Bangladesh, Pakistan, and India. Just moving on, just finally to aims and objectives. So the current RAPID study was aiming to generate evidence to support governments in low and middle income countries to make informed policy decisions about tobacco control in the context of the global crisis on COVID-19. Examine the relationship between COVID-19 and tobacco use, as I've already highlighted. And then, importantly, as all of my colleagues will present, explore how efforts to address the pandemic or other infectious disease epidemics can be integrated within tobacco control policies and interventions. We did a couple of things. We did a stakeholder consultation via an online survey with a few telephone interviews where online wasn't possible. We did a rapid literature review. And we also did desk-based mapping to look at social media feeds, and news coverage, and other aspects which are important forms of communication, always, but particularly at the current time. And then just shows you what the mapping involved in terms of looking at data sets and, data sources, including, importantly, from AFCA, actually, looking at what was being reported on tobacco use and tobacco control during the pandemic, and this gives you the dates for it. So I think that just my final slide here, just to highlight the responses. So we contacted stakeholders who were working in public health or tobacco control at different levels of government. We had 230 responses overall, and you can see the breakdown per country. And we also have data which we're happy to share with anyone who's interested for all the countries in the study that compares the responses. And I've just given one simple example here, comparing have public health or other authorities provided any advice to tobacco users during the period. And you can see that, the extent to which that occurred did vary between countries, and my colleagues will touch on that.
But Dridika asks, now after this, how do we stimulate or motivate the policy actors and the governments to bring tobacco control and COVID together? What do we go forward with? So if any of the panelists can come in, but first, Professor Linda, you had a particular question about the participants and lockdown.
Sure, if I answer that, and then I'll briefly answer the last one as well. So in terms of the stakeholders, we were in contact with them, my colleagues in each country, earlier in the study when we had a large stakeholder engagement exercise. So we recontacted those colleagues again by email or by telephone and sent them the survey link. In a small number of cases in Ghana and Uganda, we did some telephone interviews, but we didn't, I think other than a couple of exceptions in Ghana, we didn't meet any of the participants face to face. It's the same here in the UK. All the way through lockdown, we've been doing ongoing data collection when no saliva samples or other samples are required, for example, just by telephone or digital interviews. That seems the way forward. Just in terms of the other question about next steps, I think aligning communicable and non-communicable diseases are key, and I think tobacco taxation provides a really good way to do that. Corné van Walbeck, who's here, we can't hear him, but he's made the point that in South Africa with the tobacco sales ban, and Corné's part of our overall project, TCCP, the broader project, many smokers were buying illicit tobacco and they were willing to pay a huge amount of money for it. So it shows that national governments can raise taxes, smokers can pay more if they need to. And I think that given the economic crisis that we're facing now, tobacco taxation is a key source of revenue. So this is really our moment to advocate for that and continue to do so going forward, in addition to the importance of cessation, as Kellen has already said. Thank you.
Thank you, Professor. I think, Professor, you had a specific question, Professor Deresa, about these numbers, about rural area smokers and urban smokers, which seem different in Ethiopia.
Yeah, thank you very much. I would like also to thank all of you. And I really enjoyed the presentations coming from the different contexts in Africa, Ghana, Uganda, and also Ethiopia. Thank you, Linda, for organizing and ATCA for setting and organizing this webinar. So it's very enlightening and very interesting. Maybe with regard to the question, I tried to respond on the question and the answer, but it's a good question. And also, I tried to check this figure in the morning, and this is a global adult tobacco survey for Ethiopia that was conducted in 2016 with the overall prevalence of 5%, much higher for males compared to females, but there is a difference in terms of urban and rural tobacco use prevalence, where in our setting the findings indicate the higher prevalence of tobacco use in the rural areas. I'm not sure whether this is statistically significant or not, because we haven't done any statistical test, because this is the number or the prevalence that we got from the summary report of the GATT 2016. But it's not about smoking. It is about tobacco use, and maybe in terms of smoking, the urban prevalence could be higher than the rural prevalence, but tobacco can be used in different forms, particularly during the old days, and those people who have access to tobacco itself, and those who are farming tobacco plants and so on. So traditionally it used to be planted in different countries in different forms, and it could be used in different forms other than smoking itself. So maybe we will get further review of this finding and also in consultation with the Ethiopian Public Health Institute, who led the implementation of this GATT 2016 survey. But from my side, as an epidemiologist, we can also think about the sampling issues, the methodologies, and also the sample size allocation in terms of rural, in terms of urban, and so you can mention a lot of things that we need to ensure in the studies to be conducted in the future. Thank you so much.
Prof. Ellis, I must confess that part of my challenge is my limited French, but I also noticed that your name was mentioned in a number of questions that are in French, but also this comes to you and the others.
I saw those French questions. Unfortunately, I even don't know or very poor in understanding French, and I left those questions unanswered in the questions and answer. Sorry for that.
I can understand. Perhaps we will ask Lyons to maybe summarize them a little later. But there's another question that goes to you, to all of you. The question is about do we see ourselves having a study? I'm summarizing what I picked from this one. Do we see ourselves having a study which now gives focus on those who have had COVID and do use tobacco? Do we see ourselves going there?
Do you want me to start? So I think we will see those. Yes, thank you very much, Richard. I think we will see those data from some of the big cohorts. Now, the issue is that if you look at the rapid review, there aren't any studies from Africa that the team are managing to find. So I think it would be really useful to work with colleagues in Africa when you have the data on your hospitalizations and also mortality. And I'm sure able to find out through time, but it would be great to have some of those findings from Africa, importantly.
Maybe I can supplement, Linda.
Yes, go ahead, please.
Yeah, thank you very much. I think this is and this issue has been a topic of discussion in Ethiopia, and since the COVID-19, and Ethiopia is now, in terms of the number of cases of COVID, the fourth country in Africa, next to South Africa, Egypt, and Ghana. And as of yesterday, there were 64,000 cases and more than 1,000 deaths. And I am a member of the Ministry of Health National COVID-19 Research Task Force, and we have been involved in different proposals, reviewing proposals, and also raising research questions. And maybe the gap that we have identified so far is there is a cohort study ongoing by the Ethiopian Public Health Institute, and also in the hospitals and in the COVID-19 treatment centers. It's not only tobacco use or smoking, but what are the other factors, predisposing factors? It could be comorbidity or pre-existing or age or biological factors, or like, for example, the style of living, the social economy. Tobacco is one of the social or risk factor. So the National Research Institute or the Ministry of Health is looking for such kind of information. And unfortunately, the research or the activities, whether through the cohort or retrospectively by reviewing the records of the COVID-19 disease or cases, we didn't come to, we didn't get enough information about this one. And that information, we will be looking for this information, and we will be encouraging researchers at the Ministry of Health or national or research institutes or university or academic institutions. This could be one of the research topics that could be addressed, I think maybe by the end of this year or mid of the next year. So it's a relevant question, and I know that many institutions, many Ministry of Health individuals, researchers are looking or seeking this information. And we are at the same level of looking at this information, and we hope more information will come as evidence is now emerging and emerging. Our understanding about the COVID-19 is getting better and better, and in terms of epidemiology, in terms of clinical, or in terms of behavioral aspects, response. So things are getting better compared to 3 or 4 months later ago. Thank you so much.
Amasaganalo, Professor, just a question for Professor Osu. There was a participant who was asking that you said shisha is not banned, and from the question, a lot of young people are getting crazy around shisha. What is stopping you in Ghana from banning shisha like some of the other countries?
Thank you, Richard. I tried to answer this question via text, but I'll go ahead and say this. So essentially, we do have a Tobacco Control Act. We do have a public health law, but you know, there's always been influence. It's about policy makers and implementation of what is supposed to be something that is supposed to be for public health. In this case, shisha has had a bit of undertones as far as the industry is concerned, and the appeal is headed towards the youth, as I indicated. So we're still talking, and hopefully as we keep pushing through this medium and several other media that we have been proposing, very soon we shall see action as far as shisha is concerned. We're talking about it, and we've made the findings very clear, and we've written about this. So hopefully, as we incorporate this in the various communique, press releases, and so on and so forth, our voices will be heard, and we will push back the activities of the industry, which are obviously are innocuous in many of the ways in which they approach a specific target market. Thank you.
And as we come close to the end of this, Kevin, a participant wanted to find out, from your presentation, you indicate that the prevalence of tobacco use among young females in Uganda is very high, and you mentioned that it was higher compared to the other countries. Would you hazard a response as to why do you think that is happening?
Is this Kellen or is this for me? This is Ellis.
No, this is Kellen.
Yes, so I think the reasons are clear, and the increase of tobacco prevalence among the young people, and specifically the female young person. One is that shisha is an issue, so they use a lot of shisha, and shisha is looked at as an old-fashioned, product that should be used. You find a lot of females around the shisha pot and thinking it's, they don't know, they have no knowledge of what shisha is all about. So they continue to, consume it, and the vice has grown. That's one. The other reason is, of course, in Africa now we have the women emancipation, where the girl child has a lot more freedom as compared to the adult female. When you look at our parents and our great-grandparents, there was more cultural value attached to, you know, a woman not smoking as opposed to today. Today it's, you know, I'm affluent, I've gone to school, I can do whatever I want. So the girl child has taken on this kind of behavior from peer influence, from, you know, the modern way of life, and we are seeing it grow and grow. That's why you find that for most countries, actually the 3 countries presented here, have noted the prevalence for boys and girls is kind of like similar. You know, they are tying. If it is 7, the girl is either 6 or 8. If it is 9, then the girl is either 10 or 11 or 8 at the same time. So they are telling. So that's one of the reasons. The other reason is aggressive industry marketing. The tobacco industry is, you know, gone out to use terminology that attracts the young woman or the girl child in terms of, you know, you look better, you not have weight, you know, it's flavored, it's good, and so on. So that is another reason that we need to worry about the industry targeting the young girl. And especially in my presentation, they are targeting the young celebrity women. So because they know the girls follow, you know, the celebrity women a lot. They follow them in terms of what they do, how they dress, how they conduct themselves. So the industry knows if I use a young celebrity woman, then it's easy for me to hook the young girls. So those are some of the reasons why we're seeing the prevalence going high among the young girls.
Thank you so much, Kellen. Kellen Nyamurungi is a co-investigator for the Tobacco Control Capacity Program and also the COVID-19 and Tobacco Control Project at Makerere University. Thank you for joining us from Kampala. Very glad for your insights. Professor Eliso Usudabo, thank you for joining us all the way from Kumasi in Ghana, School of Public Health, Kwame Nkrumah University of Science and Technology. Professor Gary Deresa, School of Public Health at Addis Ababa University, Ethiopia. Professor Deresa, I told you that my other home is in Addis Ababa, and I'm serious about that, so I will be looking you up when I leave Kampala.
Thank you.
Oh,
looking forward to
yes.
see you.
Oh, yes. And I will look for Njera. Now, Professor Linda Bold, I must say there was another title that was added during the discussions, and it was called Indefatigable. So I didn't know that one. It was not on the CV. I think you are going to add it. So team leader, Professor Linda Bold, Bruce John Asher Chair in Public Health, Asher Institute, University of Edinburgh. Thank you so much. And the Tobacco Control Africa, the Tobacco Control Africa Talks series by the Africa Tobacco Control Alliance, ATCA, continue. So we will be continuing these discussions. This is the beginning, and from the recommendations that you gave, we can see that you still probably have much more work than you have just done. For the more than 100 participants who joined from all parts of the world, I can say a very hearty thank you on behalf of the organizers, and kindly, let's continue talking about tobacco control and COVID and fighting these 2 pandemics. And the combined pandemics will really become a major threat to public health and can threaten to undermine every achievement that we have had. I thank you so much, and I beg that we can now end here, and we shall continue the discussions. Remember, it's on YouTube. Remember, it's on Facebook. And remember, the recording of this will be shared with all of you as well as the slides. Thank you so much. Now, somebody challenged me that before I go, I should give my CV. They will notice that at the beginning, I never gave my CV because it was a line of professors, researchers, and I was intimidated. I'm just a journalist. I coordinate the Uganda Health Communication Alliance, and I'm also a tobacco control activist. My name is Richard Baguma. Thank you so much. God bless you.